the only show focused on Stars improvement strategies and the leaders who implement them. This is the Rising Stars with Rex Wallace Show, brought to you by Hyperlift.
If an organization develops a comprehensive strategy and no one actually executes it, do the falling stars make a sound? That's what we're talking about today. We're talking about the importance of execution. Welcome back to Rising Stars. I'm your host, Rex. This is your co-host, Mick Toomey. Hey, Mick.
How you doing?
Good, thanks. And we're super excited to dig into the importance of execution today, because strategy is important, but means nothing if you don't execute it, right? So we have a couple of great guests in who know a lot about this and who do it every day in the realm of quality. So let's get right to our guests. So we have Christina Lateral Longanamodi, Staff VP Quality Improvement from Carelon Health. How did I do?
Oh, that was awesome. You hit it. You nailed it.
I might have practiced a couple of times. And then Jennifer Nguyen from the STARS program manager from Moda Health. Jennifer, that's okay on that one?
Yes, perfect.
Okay, great. Hey, we're super excited to have you guys on. I want to give you a few minutes to do your own introduction and tell a little bit more about yourself and your background, your experience in your current role in your current organization. So, Christina, would you start?
Yeah. I like to tell people I grew up in healthcare. My father was a system administrator. My mother was a nurse. And so I was bred for this quality role that I'm in today. It took me a little bit to get into the world of quality. I started off in medical coding and really created this baseline for what I'm doing today and understanding the language of how healthcare is spoken with that coding background. But I got the opportunity to build a Medicare STAR program, and that was, I don't even want to say how many years ago, but have just stuck in that path ever since, and happy to be here.
It's such a great training ground, right? STARS. It's a good laboratory. Thanks, Christina. Jennifer, what about you?
Well, I don't think that I was ever on the same path as Christina. If you had
weren't
asked
bred
me
for
where
quality?
No, I mean, I never would have even imagined I would be in health insurance. But I have a science background, a public health education background. I've always been about serving the community and the people, and that's kind of how I made my way into insurance and quality improvement. Not sure it really is a straight arrow or path, but I've been with Moda for almost 5 years now, all of which has been in quality improvement and Medicare specifically. And yeah, I've been in this specific role for a little bit over 2 years now, with kind of a greater scope in STARS oversight and strategy. So yeah, excited to be here.
Well, we're just couldn't be more excited for you to have you on today. So I think it's safe to say that, in this episode, we're going to establish the importance of execution, right? So, however, like I mentioned earlier, if we don't have strategy, then execution's really aimless, right? If we don't know where we're going, then any road will get us there. So we must have that well thought out, well constructed strategy, especially when it comes to quality improvement, right? And we're leading a matrix program across an organization. And this is where we want to dig into today is, and we'll kind of start with this question. And Jennifer, I'll actually start with you here. So, as you develop your strategy each year, right? And we have some clients who actually have quarterly sprints, so they have a kind of a unique strategy quarter by quarter, but it feeds into an overall strategy. Just curious, as you create your strategy, how do you go about that?
Well, to be fair, our strategy and strategy to strategize has kind of evolved over the past couple of years, mostly because Moda hasn't really had a strong focus in Medicare historically. We didn't even have a Medicare department for oversight and STARS until about 3 years ago, kind of a little bit before I came into the role that I am today. So it's been this evolving process. So when I took on this role, it was kind of that Q3 stage, and that's kind of where we've started. Once second plan preview comes out and we kind of get a gauge of where we're landing, it's really about digging into the data, where we landed, does it line up with our internal tracking, doing some root cause analysis of, where were the pitfalls, where were the barriers, where do we want to be, doing our best, stars math to project where we want to be next year that's reasonable, attainable, which measure priorities we really want to focus on, and then building out the strategy from there based off of those priorities and kind of bucketing it into accountable areas, whether it's pharmacy or, clinical or what have you. And then, of course, factoring in budgeting, which kind of is around that same timeline. So forecasting for the next calendar year, measurement year, what is it that we want to get to and how can we get there? But it's annual, but also kind of to your point, it's continuously evolving, and we've got strategies kind of thrown in throughout the year, just depending on what the channel is. Member facing is going to be different than provider facing, whether it's incentives, we have to line it up with contracts and things like that. So it's a little bit here and there, but I think the jumping off point is kind of that second plan preview. And, we've been driving strategy through various STARS structures. We've got an action-oriented team and also our executive level steering committee. So it's been evolving, and looking forward to working with you all this coming year to really refine our strategy and kind of move towards that more proactive. I feel like every year we're getting more proactive rather than reactive, which is what we've been historically. So yeah, it's always evolving, that living that quality improvement life, really.
I love your statement, Jennifer, strategizing, or strategy to strategize, I think you stated. That it's just, it is constant, right, in what we're doing within quality. And Jennifer's component on the health plan side, ties into what we do on the provider side. And only most recently did I jump back into the world of provider and owning the front door. But everything that she's doing at the health plan then impacts what we're doing on the provider side to own that front door and ensure that care is being delivered on a basis that makes sense for patient populations. And so sometimes we run into challenges because we're not, as a provider, getting all the information we need in a timely fashion to ensure that we're building then the strategy for the next calendar year to ensure that we're meeting those quality expectations. And so it's this constant building of partnerships between what Jennifer is doing and what we're doing from a provider side of the world.
What about and I think this is for both of you and Mick jump in too. When the plan goal and the provider goal, when they don't align, and I'm thinking of the providers have so many quality metrics they're focused on, right, between MIPS and maybe ACOs and everything else, right? But how do you handle that? How do you kind of come to the table, or what does that look like?
Do you want to go for it? Yeah. So, we've been evolving our provider engagement strategy as well. Some relationships are more, mature than others, but when we started incentive programs for our provider partners, it was kind of what we thought was standard across other payers, really looking to see how we can align our incentive with other carriers, and competitors, mostly because of the issue that you're bringing up. We want to make sure that we're making it as easy and aligned with other priorities that providers might already have. And in kind of doing so, we've built these very close relationships with a handful or so of our providers, and we really work with them to understand, depending on how frequently we meet with them, where are their priorities for their patient population. Are there a lot of patients with diabetes that they really want to focus on, or hypertension, or what is their goal in their clinic or group of clinics? What are their workflows? We really want to have this close knit relationship with our partners to say, we have a quality improvement team. We can provide some best practices and research. We can walk you through workflows and how you can target some of these measures to kind of partner in that sense. Some clinics are more open to that type of relationship than others, of course, but that's kind of where we've evolved our relationship. We also have some clinical advisory panels with some key medical groups and hospitals, and then we'll also bring our incentive program to them to ask for feedback on an annual basis to say, what is it that you're seeing? Does this align with what you're seeing with other carriers? What other priorities in STARS and in your patient population should we consider for the future iteration of our incentive program? And we've gotten some pretty solid feedback, but again, it's, ever evolving, just like how the STARS program is always changing too.
Yeah, it's definitely a challenge because you have, from a provider perspective, and I previously was on the health plan side, so bringing that perspective into the provider world, and I started off in the provider world. I forgot how complex it is and how many rules are coming at you as a provider on a regular frequency. And so, you have multiple health plans, you have the federal government, you have clinical guidelines not always matching what the quality metrics need. And so you have this mass of information, and your primary goal is to ensure that you are seeing patients, and taking care of their needs at the right time, in the right place, and just ensuring that they are engaging and getting the healthcare that they deserve. And so it's this constant swirl of data and information and rules, guidelines coming at you on a regular basis. It's almost minute by minute.
Well, both of you just brought something up. Jennifer mentioned the ever-evolving world of quality or STARS. And Christina, you talked about, the guidelines that are always coming at you. So when you think about kind of the broader strategy development at the outset, I'm curious about like how far out are you looking? When we think about, we're looking at like for our clients right now, we've got a whole lot of things that are coming in that fundamentally change the STARS math for a lot of plans, right? You have Tukey coming in, and arguably you're going to be more impacted kind of on the lower end of performance for Tukey, but it's going to impact everybody, especially on the ops measures. On the other side, you have reward factor going away, being replaced, in a handful of years. You have the measure weight changes. And, when we've done the modeling on like reward factor going away, it is drastic, the change that this is going to make, especially when you couple it with some of this other stuff that's coming out. So how far out are you guys looking, and how does that influence the decisions you're making today in terms of the strategic and the tactical moves we're going to make, in the upcoming year?
I can tell you from a provider perspective, we are now implementing things around health equity. And so we are going for health equity accreditation. We are implementing a new EHR, and part of that discussion is ensuring that we're getting demographic information on our patient population so that we can give them the services that they need, and also partner more deeply with our health plan partners to ensure that they're getting the information they need to meet some of these health equity requirements that are coming into play. So as a provider, we are looking at this, I think, multiple years out.
That's amazing, Christina. I wish I could say with confidence that we've got, provider partners that are as forward thinking as you are. But, for us, again, our STAR strategy has been evolving. Historically, before Medicare as a department existed, everything was reactive. And we're finally getting to that place where we're more proactive. We're reading all of the memos, we're digging into all of the rulings and the proposed rules, and we're trying to be, living in multiple years at the same time, right? Closing out STAR Year 2024, looking forward to, what are we doing this year? What are we planning for future years? And, our provider relationships, we're already having discussions around incentive programming for 2024, calendar year 2024, really trying to strategize how we can structure a provider incentive program that kind of gets these upcoming changes on their radar. Even if we're not incentivizing it, at least pushing out provider education and information and engagement in that front. So, I think that's how every STARS program needs to be, right? Living in multiple years at the same time.
100%. Yeah.
Mm-hmm. And you get that strategy in place, right? And you guys have laid out a lot of the important components of that, as far as obviously data, right? That informs it, and getting the right people engaged, like providers. We've definitely dived into here, and also making sure that the budget, not that the not making sure the strategy aligns with the budget necessarily, but make sure the budget is adequate to and influenced, right, to be where it needs to be to inform, or to make your strategy possible, right? But then we have to execute it, right? And I was having lunch with a client one time, and I'll never forget this. And it was a VP of Medicare at a client, underperforming plan, MA plan, right? And she said, I realized something recently. All the people on my team, or the vast majority of people on my team, have job titles that have the word strategy in it, but I don't have a single person on my team who has the word execution in it. And it made her really think through, like, the message that sends, right? As our teams are not just responsible for strategizing, but for, execution. And I'm curious if you can spend a few minutes now on, how do you, and Christina, we can start with you this time. How do you ensure the organization is executing on that strategy that you spent so much time and making sure it's put together, well constructed, well, articulated, informed by data, backed by budget, et cetera, but then you still got to do it. How do you get the organization engaged to actually do it?
I love this question, Rex, because I have a master's in leadership and management. And so this is right up my alley. I love building teams, building organizations. And so, part of coming into an organization new, and I came in Q3 as well, Jennifer into CareMore last year. But it is understanding the people that are currently there through things like assessments and, understanding what their likes are, understanding how, they work, and then fitting that together. And so sometimes as a leader, that you have a gap. And maybe that gap is execution through understanding what the values and morals and beliefs are of the people that are on your team. And when you find that, what you need to do is fill that gap. And so you find individuals, you ask for additional resources, you put people in the right seats on the bus so that they are effective and happy and engaged in the work that they do. But you also get buy-in from leadership as you're doing this. And so part of that is being diligent as a leader and understanding your data, your metrics. It is creating partnerships with individuals within the organization that are already there. So you don't need to execute on everything, that you were really teaching the teachers to go ahead and execute on things that need to happen and embed that within the normal day-to-day processes throughout the organization. We meet on a weekly basis with each of our markets. So we're spread across the entire United States, and we meet on a weekly basis with each of our markets and talk with those executors. So the people on the front line, the clinic staff, the virtual back office, the GMs of that market, and talk to them about where they are currently at within the STAR program that we are managing, and talk through ideas if we see that we are underperforming in certain metrics, and help them to get buy-in from the senior leadership within the organization to get them the resources or process changes that they need throughout the organization. So it's really first understanding who you have, what they want to do, and who they want to be when they grow up, and just fitting the right people. I look at it as one big puzzle piece.
And let me jump in on that one, because the way you just explained that, Christina, it sounds very similar to the process that you had in one of my most memorable discussions I've ever had at a conference, when you had taken your previous plan from 3 stars to 4.5 stars in 1 year. And so I asked to sit down with you and just get an understanding of what you were doing over there, to better understand. And if I remember correctly, it sounded very similar to what you're now doing on the provider side, but you met with, let's say, clinical on a Monday, pharmacy on a Tuesday. Essentially, you hit every measure set every 1 day per week. So kind of went through all that. So it sounds like that might just be your process here.
It is.
Is that
Yeah, it is.
And
I love it. I love it because I've kind of tweaked it slightly to fit into the provider world, and it's more of a market focus because we have less measures to focus on than a health plan perspective. And so it is the exact same approach. The approach to leadership and management in healthcare, from health plan to provider, and being able to execute effectively, is the exact same approach. So you are absolutely right, Mick. I've taken those learnings, and I'm applying it to everything else I do within the healthcare sphere.
Well, it makes sense. It seems to work.
Yeah, when you have a pattern, right? I mean, it sounds like Mike Krzyzewski, right, or like some famous coach, kind of the same method that you're going through there. What about you, Jennifer?
I mean, I think we share in a lot of the same strategies, right? The buy-in, the constant engagement, the communication. I think all of it is part of great leadership and execution, kind of to what Christina was saying. And so for us at Moda, we've really started, changing the culture around quality. Once, our department was really established, it was really, how do we communicate top down, bottom up, that quality is everyone's responsibility. And I think part of that cultural shift and focus on Medicare and quality in general needed to take place, and get that buy-in from, every aspect of our organization first. And from there, we really honed in on the key players, the stakeholders, the ones that are responsible, similar to what Christina was saying. And we have, I guess, varying levels, if you want to think about it that way, of those that are doing the work. We have this action-oriented team that is the managers and the supervisors and, their staff that's really executing and doing the work. We meet on a regular basis to talk about, the initiatives that are taking place, really surface up any barriers that any team is happening or that they're experiencing, whether it's pharmacy or operations or customer service. Like, everyone that is accountable to STARS is in that group, the doers of the STARS team. And then we also have our kind of executive level steering committee, again, across all accountability areas that meet bi-weekly to talk about strategy, not only what are we doing right now, and also that forward thinking of, well, we're in May now. What are we doing? What do we have lined up in the next coming months? Where are we tracking in terms of performance? So it's really that communication and engagement at all levels, the continued monitoring of performance, whether it's our internal dashboard or what we're hoping to partner with Mick in the coming months. We'll have, greater granularity and deeper analysis on performance, so that, goes hand in hand with all of the times that we meet, with the varying teams. And I think one of the biggest overarching things that I can't leave out is really alignment of organizational goals, really. So, we're just a piece of the pie. We just, I selfishly just care about Medicare. And sometimes it's hard to think that there's other folks that are working on commercial and Medicaid and other things. And it's really how do we really align Medicare goals with all of the other lines of business and kind of the MODA goals in general? Because, without that alignment, without finding those synergies and things like that, we lose a little bit of traction and we get a little bit of abrasion. So I think maybe those are kind of the biggest buckets to help ensure that there's execution on strategy and not just a really nice document that we can read.
I love that. And I think, and you've all three said something about this, but the fact that, for execution to really happen, I mean, the strategy, I guess, for lack of a better word, the strategy has to be executable, right? Like and I think Christina, you talked about like understanding the people that you have who are going to execute this, right? Such a huge component of that. Make who what's the hand that I've been dealt, and how do I really make sure they buy in and engage? But then you've all talked about targets too, right? Or goals. Like Jennifer, you were talking about being aligned with corporate goals. And I know I've been guilty in the past of being so focused on Medicare and making sure everyone in the organization understood Medicare is the most important thing, right? but that doesn't work always, right? Like you lose credibility when you only talk about your line of business. So you have to find those ways to align it with corporate goals. And on the goals too, and I've learned this, or definitely it's been reinforced in my work with Mick and his company, but his tools, where when we're building goals for measures too, right? Like we can't just, at least in my experience, in my opinion, and I know Mick shares this, like we can't just say, hey, we're gonna have 5 stars on every goal this year. Or I'm curious as to both of your perspectives on this, because when we talk about executing on this strategy, it needs to be a stretch, but it needs to be realistic, right? So if we've always gotten 2 stars in osteoporosis, we're probably not going to get 5 this year, right? And putting 5 on there just means it's going to be red all year long, and whoever owns that measure is going to be frustrated every time we go into a meeting and have a report out. So those goals have to be executable, right? Like they have to be realistic target. They have to achieve our overall goal. But curious as to your do you agree with that? Do you have other perspectives on measure level goals to engage the organization?
I chuckle a little bit, Rex, because it feels like every CEO that I've worked under is 5-star, right? 5-star, 5-star, 5-star. And that's all you hear. And yes, it is a definite stretch goal for overall, for independent measures, but you are dead on. As an operator, as an executor, as a strategist, as a leader, of this area, you need to understand, what is possible. And so having conversations, setting stretch goals, but also being able to flex to the dynamic nature of healthcare, because things change constantly within healthcare. Not only the rules, it's, a pandemic, right, comes into play, and all of a sudden you are not meeting the needs of the measures, and you have no idea how CMS is going to calculate them in the future. And so in healthcare, I think we need to be dynamic, and especially in the world of quality improvement and quality management, and help set realistic expectations for people.
Yes, absolutely. And I mean, we started out setting kind of annual measure level goals. I mentioned I came from a public health background, so I'm always about setting SMART goals, right? They're specific and measurable and attainable, whatever the acronym is. So that's kind of how
I
we've
was hoping
always
you were going to quiz me there on that.
time bound. I don't know. It's been a while.
Relevant, yeah.
But yeah, it's always been around what is achievable. And then it's the prioritization of the measures, right? If there's a measure that we've historically been high performing at, then, our goal is just to maintain. If we can just maintain it and we can shift some focus and some resources elsewhere to, mid, lower performing measures, higher weighted measures, like that's kind of the strategy. And we would set, not just annual measure level goals, but quarterly to see, well, are we meeting it in Q1? If we're not, something's off. What's happening? Where's the breakdown? And what kind of effort do we need to push? And can we push, in the next quarter and not wait until that Q4 blitz that, we all scramble. So yeah, a lot of it is in flux, really.
Yeah, I mean, I agree with everything that both of you guys said. I mean, the reality is, especially right now, right? The landscape is shifting, and there are a whole lot of different things you got to pull into target setting. You've got Tukey again has changed the world, right? So we've got to think about, are we now underwater for where we would have been, last year because of Tukey's changes? That's got to come into play. Understanding kind of the bang for the buck, moving every measure isn't the same impact. And I'm not talking specifically about weight. It is, where are you in cut point proximity? Does that get me to likely a next star? Do I think about what do I need to put in place to get up above that QI significant improvement? How does the weight change shift my focus? So many different things to consider. And like both of you guys said, being realistic, understanding what's a true realistic goal. And we go after some of this with both planned and stretch. So we set a planned and stretch target for each measure. Planned is what we show people, and stretch allows us to be a little bit more aggressive, but let's not set expectations for that level of performance. But it is an internal goal. So that's one way we go after that.
It's funny because I think I do the reverse. I communicate out stretch, right? And I would say semi-realistic stretch, but know in the background and hold tight that, realistic is probably this, and go out with stretch to the operators, but realistic to the CEOs, right? And
See, I thought you were saying you were going with the stretch to the CEOs. I was like, that's great.
That's what I thought.
No, I am definitely a under promise, over deliver type of person.
There you go. So, yeah,
that's the key. Yeah,
that makes sense.
I'm glad you brought up Tukey and kind of the shifting, and the reason why I think is because being back in the provider world, I am finding it extremely difficult to take in all of the predicted cut points from our health plan organizations and work with something that is realistic, because I, as a provider, want to help these health plans succeed, because if they succeed, we're going to succeed as an organization. But I am finding it extremely difficult to take all of those into consideration and provide one level of expectation for my clinicians, my clinical team, because they don't want to see all the different varying cut points or thresholds or percentages. Why am I a 4-star in breast cancer screening for health plan X, but I'm not, even though the compliance percentage is more for health plan Y? And so I am finding it extremely challenging being back on the provider side, working through those complexities. I'd love to hear, and I'm sorry, am I taking your role now, Rex? I'd love to hear from Jennifer how they're working with their providers on this.
Stefan will be happy. You're good.
Well, I mean, to be fair, I think it's a little bit more nuanced, because I think you driving stars at your, it's different than how our other providers are used to engaging in terms of stars because they're not as engaged, they're not as informed, and we're finding our struggle is educating our providers on stars and their changes. So I don't know if even our largest provider partners, they're not looking at stars in the same way that you are. So I don't know if I have a good answer for you. But as we're evolving our incentive program, we're not using star threshold to measure provider performance. We're really just basing it off of numerator and denominator. And that's the conversation that we're having with our providers because, for them, they're not seeing the bigger picture of stars, and we're not measuring them on a star threshold. We're measuring them just solely on compliance. So that makes the conversation a little bit maybe easier, at least simpler for now. So I don't know if I have a silver bullet for you, but I think our approach has really just been, where is their focus? Their focus is their patients. Their focus is gap closure and overall health outcomes. And that's kind of how we frame it. And instead of, here's where you're at in star performance, really honing it into that patient relationship that they have.
Well, and I sympathize with you, Christina, because the reality is there's a lot of nuance that happens in stars, and frankly, it gets missed by a decent percentage of folks in the space, and I would say probably more so when you get to the provider level of things, and if people are creating incentive programs, that kind of thing, based on a lot of plans that we know use prior year cut points, and this year, I mean, I think as a general rule, that's a risky proposition. But this year in particular, you're going to be incenting things that really go the wrong direction. And so a lot of it, like Jennifer was saying, is around education, and education at the nuanced level to help people truly understand. CMS did release their version. So let's say this is the most maybe accurate, view that you can get for what happened in STARS 2023 if Tukey had been in place. At least start with that, as you're sharing this with people, because just that alone will really shake up the organization in terms of expectations of where we need to be to achieve certain levels.
And can I just plead for all the health plan people that are going to be watching this that please don't change the cut points and thresholds on providers come October, because it just makes it really messy for us.
Yeah, and I know that when we have plenty of clients who struggle with, or where the provider will come back and say, hey, but payer A is holding me to this threshold or incenting me for this threshold. Yours is way different, or in their in trying to, they want, of course they want one consistent set of cut points for all payers, which is not happening. And I think, and you guys have kind of all alluded to this, and this was going to be my last question, and then we can open up if you have anything that we haven't touched on yet. But education, Jennifer, you brought it up, I think, but we've kind of all touched on it a little bit. But I think, at all levels, right, with providers, with measure owners, frontline staff, executives, through our governance committees, and like, to me, that's one of the most important things. But I'm curious, do you have tactics that you're deploying internally, any kind of secret sauce on educating the key people that need to know what they need to know about stars or quality?
Go ahead,
Christina. Me. Well, so I don't know if we have a secret sauce. I think we just kind of, fling something out and see if it sticks. And we're trying to do it at all levels, in terms of, educating and building that quality culture at MODA. One of the first things that I wanted to do and accomplish in taking this role was building out and implementing an annual training on Medicare stars, kind of like a stars 101 that, all of our employees take. And I think that has really been impactful, just so that everyone can understand, kind of at a high level, what is Medicare Stars? Why is it important? How do I influence it? Even though I'm over here processing claims or, doing something that seemingly is like, entirely unrelated. So I think that was a step in the right direction. Building the star structures that we have right now, not just having, those doers that are engaged and the executive level, but, we also report out to our CEO on a quarterly basis and kind of continue to re-educate, because kind of to what Christina was saying, CEOs are always about, why aren't we at 5 stars yet?
Right.
So it's really, continuous education at that level, however they want to, ingest and digest that information of stars is a long game. This is where we're at. This is, these are the changes. And, I think with the Tukey and all of those other nuances, there's going to be a significant re-education of that level of leadership to kind of reset and re-gauge of, where we were last year, where we could have been, where we will be because of those changes. So I think that's a constant thing that we're pursuing internally. And with our provider partners, it's really whoever will engage with us and listen to us. I wish we had more provider partners like Christina that are so, up on their game in stars, but it's really kind of catering the message and education and resources to what they want. And our clinic advisory panel can, they weigh in and say like, well, risk adjustment is a hot topic right now, or, diabetes is really hot for my clinic and we want some more like best practices and workflows. So, on the provider front, it's really kind of a very catered education process that we have. And we, solicit feedback and see what sticks really.
I love that you brought up educating the entire organization. It brought back an awesome memory that I have where I think I did a road show within one of the organizations that I worked at, and it was every single functional area, educated them, had prizes and, all this fun stuff to get people engaged. And then we had a trophy. So the teams that were performing on their metrics got the trophy for that month, and it was kind of passed around the organization to keep people engaged in the culture of quality improvement and Medicare Star. But from a provider perspective, I can tell you that my frontline clinicians are not engaging in health plan education. And so what we're doing and building at CareMore Health is we are building something called Quick Hits. And where I want to get this to, and we're not there yet, is this TikTok-like approach where people are showing and acting, within the most probably 3 minutes. So a provider can look at this, engage in it, visualize it, know what needs to happen, or maybe just remind them, because they're clinicians. They know how to take care of patients, but remind them as to what is effective. And so we're working on building that with our clinician community.
I love that. Someone recommended to me recently that that's what Stars 101 should be. Not an online platform on a learning management system, but, or at least maybe it's both, right? Maybe different modes for different employees, right? But to have, TikTok style. I love that. Yeah. Hey, and 30 seconds or less. Anything we missed? Anything we didn't touch on?
No, that was great.
I think it's been
This
great.
conversation was wonderful.
I thought so too. Really good stuff. Okay. Well, Jennifer, Christina, thanks so much for joining us. That really was a great episode. So looking forward to getting this out there. I'm sure our listeners are gonna value it. So thanks for joining us today. Great digging into a little bit of strategy and a lot of execution, some really important things. So thanks so much. We'll talk next time, everyone.
Thanks so much.
Everybody.
Thanks.
Yeah.